Well, hello and welcome. I'm Dr. Brenda Jones, one of the professors here at the School of Nursing, and I have one of our own nursing students, Abby Cook. And so we're going to be providing some sections of videos so that you can watch about the skills that we teach in 306. So enjoy them and have a good time.
So we're back again. We're going to be doing the newborn bath today. So to start, you're going to want to first check your orders and your last documentation on the newborn, and then you're going to want to begin by checking the cardiorespiratory and thermal status of the newborn prior to the procedure. Then make sure that you have a warm room with a flat surface at comfortable working height. So then we've gathered all of our supplies. We have our 2 washcloths, our towel, our alcohol pads, and our cotton balls, and then we'll have our soap and our basin with water. So we've gathered our supplies. We're first going to come in and check our newborn identification band. So the 2 identifiers for the mom and the baby, and then we're going to explain to the mom. Today we're going to be doing our bath and a little bit of teaching paired in. So we've placed our towel, or you could do a blanket underneath for the bath to make sure that it's kind of easier to clean up after. And this is also a procedure you want to make sure to promote thermoregulation since they are wet. So you really want to pay attention to be drying and performing the bath as quick as possible. So we'll begin, take this blanket underneath and put that there. So we're going to start with our cleanest to our most soiled areas. So let's put on our gloves. And then we're going to go ahead and grab a cotton ball for each eye. So you're just going to wet it. And then you're going to go from inner corner to outer corner. And then you're going to want to dry as you go. And then you're going to do the other eye using separate cotton balls, inner corner to outer corner. And go ahead and dry that. And then you're just going to want to use a washcloth with plain water over the entire face, including the ears. So we're going to kind of wring out that there. And we're going to gently wash the face and the ears. And we're just going to set that there, and we're going to go ahead and dry the face. And since the face is so small, you even could use another washcloth if you have another dry washcloth, so it's not as bulky. So then we're going to do their hair. So you, excuse me, you would put some mild soap and then get your washcloth wet. And you would want to cleanse their hair gently, especially with the fontanelles. And after you've done that, then you'll of course rinse the soap off. And then we'll go ahead and dry. Since you're done with the head, you can go ahead and put the cap back on to ensure that their head doesn't get too cold and they lose too much heat. So then you're going to want to go to the neck next. So after the head, then you can use mild soap. So now you can also tell the mom you want to pay attention to anything that has creases or folds and maybe wash those a little bit more thoroughly, and teach that they're going to want to wipe underneath the neck after each feeding due to the milk that can get down in there. So we're going to dry that. Then next we're going to go ahead and wash the extremities, trunk and back. So with our mild soap and water, then we'll wash each arm, making sure to get the hands and underneath. You want to make sure as you're doing this, you want to get any of the vernix and things like that off the baby. So you're being thorough but gentle. Then rinse. And I like to do the top extremities first and then dry, and then we'll do the bottom extremities and then dry. like I said, because you want to make sure that they're not getting too cold and losing too much heat. So we'll do their legs and their feet. And then we would again rinse and dry. Now we're going to do their trunk and their back. And when we turn the baby over, make sure we get the back. We'll go ahead and rinse the back since we're here. And dry. And then make sure we're dry on the front. So we're going to stop for just a second to do some teaching for the umbilical cord. So make sure they're warm. So for the parents for the umbilical cord, you're going to want to make sure every time to kind of notice and look out for any bleeding, redness, and a foul odor, and make sure that they understand the necessity of reporting that to the provider if they do notice it. You also want to sponge bathe until the cord completely falls off, and only immerse them in water after it's completely healed. After each diaper change, then they're going to want to use an alcohol wipe and just rub around that umbilical cord area, because this will help promote the healing also and the cleaning of it. And then you're going to want to also, to help promote healing, expose the stump to air as much as possible. And you never want to attempt to loosen it by pulling it. Also, you want to, when you're changing a diaper, fold it down so that it doesn't rub up against that umbilical cord, because this will help prevent the tugging and pulling. So after we've done the umbilical cord, then we can move on to washing the diaper area. So for the diaper area, if you notice that their diaper is soiled, then you would obviously want to clean it, but then afterwards discard and wash your hands and get new gloves to continue the bathing procedure. So you're just going to wash. For a little girl, you want to make sure that the parents know to wipe from front to back to prevent any infection. And then for a little boy, if he is uncircumcised, you want to make sure that they know to not force the foreskin back and to just gently wash. And you're again using the mild soap and then rinsing on the diaper area as well. And you'll want to do a new diaper. For diaper changes, a little bit of teaching. If they are circumcised, then you're going to want to each diaper change and after each bath, put a little bit of petroleum jelly on the tip of the penis. This will help not from the rubbing against the diaper and pulling that off. And then to know that they're adequately hydrated, if they should be going through roughly 6 to 12 diapers each day. You're going to want to notice the stool characteristics. There's a difference between the breastfeed stool and the bottle-fed stool. So your breastfeed should be more mustard and seedy consistency, whereas your bottle-fed will be a little bit thicker and stickier with a yellow tan color. So after you've done all that, then we're going to talk a little bit about safety with the mom. So we would clothe the baby with a new change of clothes. And while we're talking about safety, you want to ensure that they have a federally approved car seat, and that during bathing or if ever they're on a high surface, that they're never left unattended. You also want to make sure for sleeping that they can sleep up to 15 hours a day, 2 to 4 hours at a time, and that they're sleeping in a crib on their back to prevent SIDS, with no extra pillows or crib bumpers or any sheepskin, anything like that. It really should just be them to make sure that they're the safest. You don't want to do any bed sharing of any kind. And to help promote bonding between the mother and the baby, they can do skin-to-skin contact while they're feeding or cradling. So after they've done that, then I would swaddle the newborn and have the mom do a return demonstration of the swaddling, since the swaddling is very important for their warmth and thermoregulation, so the mother should know how to adequately perform that skill. So we're going to make sure that the baby is comfortable, and if we notice any abnormalities, then we would make sure to note those and document those. We will make sure the mother's also in a comfortable position. We're going to discard our gloves and document our procedure and how the newborn tolerated the procedure, as well as anything else that we found that could vary from our normals. And then we're good to go.